Hello everybody and welcome back to my channel, or if you're new then welcome. Hi, I'm Grace and I'm a second year BSc microbiology student at the University of Leeds. So in today's video I'm going to be talking to you about my placement application experience for Cancer Research UK. So I'm going to be going over the role that I applied for, the different steps, the interview and the overall experience that I had. So make sure to give this video a big thumbs up, subscribe down below and let's get into the video. The placement that I applied for was Medical Writing and Pharmacovigilance Assistant at Cancer Research UK, and this is actually part of the CDD, which is the Centre for Drug Development. I first found out about this placement when I saw it advertised in a university newsletter, and it was saying that the team from the CDD and from Cancer Research were coming online to do a presentation for the University of Leeds regarding this role. So obviously I went along to this presentation, or watched this online presentation, and they gave information about the placement, about the company, the application process and things like that. Their current intern, so their current medical writing and pharmacovigilance assistant was there. He was from the University of Leeds as well, so he was sort of leading the presentation alongside some of the other members of the team. So there were some people from regulatory affairs, medical writing and other teams as well. For those of you that don't know, medical writing is essentially the written communication side to science and drug development. The role really varies depending on the company and the role that you're currently in. So for example, you could be writing regulatory or drug development documents, you could be publishing scientific articles, so it really does vary. Essentially for this role, given that it was the Centre for Drug Development and Cancer Research, this medical writing role was primarily to do with specific sort of drug development documents and regulatory documents. So I basically wanted to apply because initially I had quite an interest in medical writing, a profession that I'd seen pop up that I'd researched into that I thought maybe could be for me. You'll find as I do more videos of my different experiences applying for different placements that this perhaps isn't the way that I want to go in the future, but you never know, it may be. But yeah, initially this is why I wanted to apply for this role, because of the medical writing side of things. But obviously this still did include pharmacovigilance, which I hadn't even heard of before I saw this role. Essentially, pharmacovigilance is the safety side to drug development, so it's making sure that there's limited side effects to participants in clinical trials, and just making sure that they are as safe as possible and that the benefits of a trial or development of a drug outweigh the risks. So in terms of the actual application side of things, they required you to submit your CV. So it was an online sort of application profile, and you had to submit your CV on there, and then they asked for sort of general personal details, such as, you know, like your name and things like that. And then they also had some application questions which they wanted you to answer. So these were, I'm just going to read them out. So it was, why have you applied for this role? Why do you want to apply for this role? What do you know about the CDD? So what do you know about the Centre of Drug Development for Cancer Research? So obviously they're checking you've done your research into the company. Which research strategy approach has the biggest impact? So for this question, they sort of gave 4 examples of research strategies and just asked you to give your opinion on one. I don't think there was a right or wrong answer. I think it was just seeing your reasoning skills. The next one was describe a personal achievement. So I suppose this is just trying to pick out sort of other things that you are interested in rather than just sort of university and your degree in science. And then they asked you to sort of talk about clinical trial guidelines. So they gave specific examples of sort of national and international guidelines which are out there, and asked you to sort of explain and talk about them. So again, make sure you're doing your research. And then the final question was asking about career plans. So I guess this was to see that why you actually wanted this placement and how that would benefit you in the future. There's a range of questions there. I didn't find it too bad, the actual sort of application. It was pretty standard. So yeah, that part of things is absolutely fine. I then got an email saying that I had been successful with the initial application and they invited me to interview. So it was straight away application, interview. There was just 2 stages essentially. However, the interview did involve a lot of different steps, which if you watch my other videos, which I'll be uploading soon, the steps that were part of this interview all in one for a lot of different companies which I applied for actually in separate stages. So for this interview, first they did, one of the staff did a short presentation, which is pretty similar to the one I'd seen when they did the initial presentation about the role for the University of Leeds. But the good thing about this is it sort of stimulated your brain and made you think about different parts of the company. So when it came to the actual interview, I still had these sort of facts and things in my head which I could use then, so that was really beneficial. After the presentation, I then had to do 2 tests. So when I was saying about other companies doing separate these things separately, so for example for another company I had to do these tests in my own time, and then for another one that we did these tests in a session before the actual interview. So if you passed those tests, you went on to the interview kind of thing. But for this, I had to do a medical writing test and a pharmacovigilance test. Obviously considering those are the roles. So the medical writing test was absolutely fine. It was sort of like a letter format. You had to pick out all like the grammar and spelling and format mistakes, which is something that I do generally. I'm a bit of OCD for like picking out when people have put apostrophes and things in the wrong place, so that was fine. And then for the pharmacovigilance one, it was sort of presented with different safety documents, and you had to sort of summarise what you could see from the documents and pick out key data essentially. So quite different tests, and I thought they were okay, to be honest. I didn't really have any issues. I think the only thing was perhaps the time pressure, but that's always an issue for a majority of people when it comes to tests like these things, especially when they're unknown. Obviously I didn't know what the tests were going to involve beforehand. But apart from that, absolutely fine. So then after the tests, I had the actual interview. So this was with the pharmacovigilance manager and the medical writing manager, who were both so lovely. They just sort of asked me some questions specifically to the Centre of Drug Development and Cancer Research, which some were a little bit tricky. They were asked for sort of specific drug names and things like that, and I had sort of done my research, and I had like papers and stuff printed out, and I'll talk about in my other video is I developed a much better system of having sort of notes with, because obviously it's online, you can have notes and stuff with you. I basically developed a much better system where I just had a summary sheet on my monitor and then the like video interview on the computer, so it was a lot easier to look at those notes rather than having lots of sheets printed out, which I had for Cancer Research, which was my first interview. So when they were asking the questions about sort of Cancer Research and Centre for Drug Development, there was a couple which I was a little bit unsure of, but in terms of when they went on to the actual sort of competency-based questions and give me an example of this and give me an example of when you've done that kind of thing, that's absolutely fine, and I was praised on that, which was really positive. After my interview, which was the 17th of December, I believe, I then was essentially waiting for the offer, and unfortunately this did take a long time, and the fact that it took so long, I kind of had an inkling that perhaps I hadn't gotten the role. And if anything, at first I sort of just said, oh, I just want to get this role, I just want to sort of get the placement applications and stuff out of the way. But in hindsight, I'm actually really pleased that I didn't get the role, which sounds really weird because as I said previously, I realised this actually wasn't the kind of role which I think I would have enjoyed as much as the one which I'm going on to now with McCann, and compared to the other ones I applied for as well. So I was actually now can say that I was pleased about not getting that role, but it wasn't too much of sort of an upset when I found out, because as I said, I was expecting it because it did take so long. I think I found out on I think it was like the 6th of January or something. It was 2 or 3 weeks or something after, which is really long time. So I wasn't too disheartened, and the feedback they gave was really positive. It was really good that they did give feedback as well. So they said a lot of positives in terms of my confidence and giving answering the competency-based questions and things like that. And then in terms of the improvements, it was what I thought, is in terms of just knowing the company a little bit better in terms of sort of the specific drugs which they've rolled out. They also said that my application and CV were really well written. it's really hard to say, were really well written, and that my personality shone through, and that they were really impressed by my YouTube channel. So thanks guys for helping me keep this going. Some of the more specific things I'll just read out now. So they said that I articulated answers with maturity, and they said that I had a good understanding of clinical research and of the role in medical writing. And they said I asked good questions at the end of the interview as well, which I think people don't often think about when actually you think they are going to be sort of judging you on the questions you do ask. So always have a couple of those prepared is sort of a top tip of mine. And then they just said about more detailed research of the CDD, so specific names of products and things like that. I just thought I'd go over sort of the pros and cons of the experience. So in terms of the actual application and CV, it wasn't too bad. Personally, I prefer just a CV and cover letter because it's easier obviously to do, but it wasn't a burden at all. It was pretty simple to go through. In terms of sort of the communication from the team, so that was basically run by the current intern, and he was very good at sort of replying to emails and sending out information. There was like no mistakes in the emails and things like that, so you could tell it was taken seriously and done very well. The actual team and the interviewers were so lovely as well. They made me feel really comfortable. Obviously before things like this you're naturally nervous, but I think when you go into something and people interviewing you are really sort of down to earth and really kind, it makes you feel a lot less pressure in that situation, a lot more comfortable. It makes it easier to sort of answer questions and talk about yourself. I also really liked that I actually had the chance to talk to the medical writing and pharmacovigilance teams. I forgot to mention that after the interview I actually had the chance to do that, which was really positive. And again, they were really lovely, so I could definitely tell that it was such a positive company. I actually had a really positive experience with a lot of the companies I did apply for. There was only a few things here and there which were perhaps a little bit negative, but not predominantly so. Then when I was thinking of cons, I couldn't really think of too many, to be honest. I thought it was really good the way they did things. I suppose the only thing was that the actual sort of interview day was quite long. I can't remember exactly how long. I want to say 3 to 4 hours, because we had the presentation, had the initial sort of like chat with the intern, then the presentation, the current intern even, and then the little presentation which was maybe like 20 minutes, and then I had the tests which I want to say were an hour and 15, something like that. Then the actual interview which was about an hour, and then the talk with the other teams. So I think it was about 3 to 4 hours, so it was a long time to sort of be sitting there. I did get a short, I think it was 5 or 10 minute break in the middle, but it was a long time to be doing things. But then again, it was easier to sort of just get it all done and out of the way rather than having to attend lots of different sessions like I had to do with some of the other companies I applied for. So it was a con in terms of having to be there for so long, but it was a pro at the same time compared to having to do it all at different times, I suppose. Overall, it was a really positive experience, and if anyone is thinking about applying to the company, I would really recommend it. They're definitely a really positive team, and I think just their goal in working to cure cancer and save lives just says it all, to be honest. So I hope you guys have enjoyed this video and got a bit more of an insight into sort of the companies out there that you could apply to, not in terms of just placements, but in terms of jobs and other roles as well. So I will be doing some more videos on the other companies that I applied for. Next up will be Disney, which is exciting and probably a little bit surprising to a lot of you as well, into how that relates to my degree at all, but I will tell you more in that video, so be sure to watch. I'm probably going to do maybe a general video as well, just talking about giving like tips and tricks when it comes to sort of applying for these placements and interviews and things like that. So let me know if you do want a video like that. Comment down below. Thank you so much to people who have commented recently on some of my videos. I really appreciate it. Thank you. Make sure to give this video a big thumbs up. Make sure to subscribe down below. It really means the world to me. We're so close to 400 subscribers. Really exciting. And I will see you in my next video. Bye guys.